Hello, good afternoon, friends. I'm Dr. Kavita Shah. I am a gynecologist practicing for 15 years at Star Hospital and Kavita Hospital in the city of Diamonds, that is Surat City. My hospital is, the name of my hospital is Star Hospital. It is situated at Civil Char Rasta, Ring Road, Surat. And I've done my MS from Government Medical College Surat, and I have done my laparoscopy and IVF training from Kiel, Gießen, Germany. Now we will talk about a very important topic, that is blood tests to be done during pregnancy. What all you need to check when a mother becomes pregnant. So first of all, it is it comes to confirming that the patient is pregnant. That we can do simply by a Preganews. A brand name is Preganews. It is a pregnancy checking card in which it is a simple. The patient has to take the morning urine sample, the first sample which was in the morning, and put a drop of urine in the on the test card, and the patient can do it at home itself, and then we will find that there are two lines on the card. One lines of control and the other lines of test. So the test line, when it comes positive, means the patient is pregnant. So this is the first simple test which can be done at home by any lady to check whether she is pregnant or not. This test becomes positive usually within 2 to 3 days of her periods getting overdue. If the patient is overdue by 3 days, that for example, if her date was 22 and today is 26th, so she can check it today and she may find that there are two lines and that is she is pregnant. As soon as she comes to know that she is pregnant, she has to visit her gynecologist, whichever whom she consults. And at the first visit, the gynecologist usually will check the we will usually check the blood pressure, the weight of the patient, and will rule out any high risk factor if that patient is having. After all these things, for 3 4 days, nothing will be seen on a sono scan or anything more can be done. If a patient wants to be more sure, we can test her blood for Hcg levels, and that is we can send a blood for checking the Hcg levels in the blood, which is called beta Hcg. Once there are two lines in the urine, we need not check for beta Hcg in the blood for all patients. But there are a few patients in which if a gynecologist feel that they need to check the Hcg levels in the blood. Now, when the patient becomes pregnant, we need to know her hemoglobin and her blood group and her thyroid level status if she has not got it done earlier. These are the three basic tests initially which can be done at first visit. That is her hemoglobin levels, her blood group, and her thyroid levels. If they are abnormal or if there needs any correction, the treating doctor will advise further. After as this, we can divide the pregnancy into three parts. First 3 months, second 3 months, the last 3 months, covering total 9 months. So for the first 3 months, first 3 4 days we check the urine, we consulted the doctor. The doctor advised hemoglobin, blood group, and the thyroid levels. Fine, it's all done. Then you can consult the that is 2 weeks post date, the last date which she was expecting to get her menses. And after the 6 weeks, the doctor will go for a sono scan to check whether heartbeats have started appearing in the baby or not. So my main concern is only blood test. So sonography we will not discuss much. Once there is a heartbeat, medications will be prescribed to the patients and mostly will concentrate on the folic acid, B12 and D3. If the patient earlier had been D3 deficient, then the first, along with hemoglobin, blood group thyroid, we can get a D3 level done for the patient and start supplementing D3 to the patient. D3 is a vitamin, that is vitamin D. Now, as the pregnancy progresses further, around 10 weeks, if the patient earlier has some abortions, multiple abortions, or the patient age is about 35, and if she has a history of a baby who is having a Down syndrome, that is mentally retarded baby, we can go for a test which is called the NIPT. NIPT test is not recommended for each and every lady. This is for only high risk women which are classified by the gynecologist itself, and if they feel, they will get an NIPT test done to rule out any genetic problem in the baby which is progressing in the womb of the mother. Then we will go in after 10 weeks of an IPT test. Again, at between 11 to 13 weeks, we will get a sonography, which is called a USG for the NT scan. NT scan is a nuclear translucency scan. This is a sonomarker for any genetic abnormality in the baby. Along with this, if the patient was a low risk patient and there was no NIPT done, then we can go for a double marker. Double marker is a blood test which will tell us, which will give us a guidelines to say that whether the baby is genetically abnormal or not. So at between 11 to 13 weeks, we will have a NT scan, which is a sonography, and a double marker test. Both are fine, then we will move ahead. The next 3 months, which is between 12 weeks, 24 weeks. Right? So between these 3 months, we can get a detailed checkup, blood checkup of the female. That is a complete blood count. The blood, we have already done the blood group. We can get a sugar, random sugar done, a creatinine done for her kidney status, three viral markers for the HIV, HbSAg, VDRL. These four are the viral markers which will help us know whether a female is having any, the mother is having any viral infection or not. Urine examination can be done at this time because pregnancy is a state in which the patient will have may have episodes of urine infections. So to know our basal urine status, we can get a urine report done, and then all the reports are fine, good, it's all right. At 20 to 22 weeks, we can have an anomaly scan for the patient. Anomaly scan is again a sonography to check the details of all the systems formed in the baby, which will be done by a sonologist. The sonologist will check each and every part of the baby and give us a report, which is called the anomaly scan. This is around 20 weeks. If the patient has missed the NT scan and the double marker test at between 11 to 13 weeks, then we can have a quadruple marker test around 16 to between 16 to 20 weeks to rule out any genetic anomaly in the baby. So if the double marker and the NT, see, we have a sono scan and a blood scan. If the NT scan and the double marker is missed, we can get an anomaly scan and a quadruple marker between 16 to 20 weeks. 20 weeks will have a anomaly scan, but between 16 to 20 weeks we can have a quadruple marker. These are the four blood. There are four components in this marker which will guide us whether the baby is having any genetic abnormalities or not. Everything is fine, very happy, move ahead. We'll move ahead between 26 to 28 weeks. A few patients who have past history of the family history of mother having diabetes during pregnancy, or mother and father are diabetic, or she's a very obese patient, she's a patient above the age of 32, we can go in for a test which is called the DIPSY test. This is for diagnosing diabetes mellitus, diabetes which is happening only during pregnancy. Otherwise, the patient is fine. As I told you earlier, we have already checked the sugar of the patient, which was fine at that time. But as the pregnancy progresses, after the sixth month, after 26, 28 weeks, in the seventh month, patients glucose levels, which is not good for her as well as for the baby. Unless and until we check whether she's going to become diabetic during this pregnancy or not. I told you all the high risk factors. We have to go in for a test which is called DIPSY. It is a simple test. The patient has to go to the lab. She has to take a seven. She has to take 75 grams of glucose. She can take any time. She has to take a 75-gram glucose, and she has to go to the lab after 2 hours of taking that glucose. In between these 2 hours, she has to take nothing. Before 2 hours, she will take exactly 75 grams of glucose. After 2 hours, she'll go to check her random blood test. That is her blood sugar level at that time of 2 hours of taking that 75 gram oral loaded glucose. And if that sugar was more than 140 milligram, she is likely to become diabetic during this pregnancy. She has to consult a gynecologist. Then the gynecologist will move ahead. She will investigate further, he or she will investigate further, and we need to start a few treatment if she's going to get diabetic or she has already gone for diabetes. She's in a pre-diabetic state for that pregnancy. A few medications needs to be started. Again, at 32 weeks, now no more blood test. She has to go for a growth scan. Growth scan is again a sonography in which the baby weight is measured, the baby's blood supply is seen. If it is checked out, if everything is going fine or not, if everything is fine, then the baby then we have to move further. Now we are entering the ninth month. About 36 weeks, again we will have to check the patient's hemoglobin levels. Whether the patient, a few patients are not good at taking tablets at the ninth month, between 34 to 36 weeks, we get a CBC done again to check her hemoglobin levels. Whether there is a rise in the hemoglobin, there is no rise in the hemoglobin, the patient or the hemoglobin is fallen down if the patient is not taking her tablets properly, and as per the reports, the patient will be guided further. We have entered the ninth month. We'll get a sonography which is called a Doppler Sonography. This Doppler Sonography will tell if there is any cord around the neck of the baby's weight, the baby's blood supply, if there is any compromise on the blood side from the blood supply of the baby from the placental side, it is the mother's side, will be known accordingly. It will now someday near her date of delivery, patient will have the labor pains and she will deliver. All gynecologists will be wishing a healthy mother and the healthy baby. When we have a healthy mother and a healthy baby, we need to have a healthy environment for the mother. And to keep a check on it, we need to have a few blood tests, a few sonographies, which will give us a security of both mother as well as baby being healthy. So any mishaps at the time of delivery can be avoided. Thank you very much for listening to me patiently. And now I'll be waiting for any questions if my mothers want to ask me. Thank you. Hi, Kalpana. You are having 8 months pregnancy. You are having pain in the right upper portion of the stomach, feeling problem in sitting and sleeping. Probably you are having this problem because your stomach, that is your digestive part, is being compressed by the uterus. Maybe you are having gastritis. So you may start a tablet for gastritis, or that is we can say acidity. Can start taking tablets for acidity. You can go to your gynecologist, she'll prescribe a tablet for acidity, and mostly you will be fine after that. Hi, Rebecca Prakash. Uh, Brief you on negative blood group. Okay. Rebecca, if this is your first baby, the blood group is negative, just get a check of the blood group of your husband. If he is negative, it's fine. Chances of your baby being negative are higher. If he is positive, nothing more to be done. You can get an indirect Coombs test done. If the indirect Coombs test is negative, you are fine. And if it is positive, you can consult your doctor. You don't have to worry about your blood group being negative. You just only have to take care that you maintain your hemoglobin levels. So you keep on taking the tablets of iron prescribed by your doctor on time, properly. So you need, because if in case at a time of delivery you need blood, patients with negative blood group find sometimes difficulty in getting blood at the time of the delivery. So you have to keep yourself fit at the level of hemoglobin levels. And at 28 weeks and at the time of delivery, after checking the blood group of the baby, you need to take one injection which is called the NTD injections. This will be guided you by your gynecologist. Hi Sonam. Which are the important tests to be done in each trimester? If you have watched me live, Sonam, I have mentioned all the tests which are to be done, but I'll just highlight the important ones. One is your hemoglobin level. If we go for blood test, one is your hemoglobin level, your blood group, your thyroid during the first trimester, along with your double marker between 11 to 13 weeks. Moving ahead in the second trimester, we'll get the whole antenatal profile of yours. That is your CBC, your blood, your sugar, your creatinine levels, your three viral markers for HIV, hepatitis B, HCV, VDRS, that is for syphilis, your urine examination, your hemoglobin electrophoresis if you come from a few backgrounds, which is advisable usually for all hemoglobin electrophoresis. And as I told you, when you move to 26 to 28 weeks, you can get a test called DIPSI test, that is 25-gram oral glucose tolerance test. Mostly this would suffice, and at the last trimester, nearing your last trimester, you can get a test called Hi Shivani, you are 15 weeks pregnant and your NT weeks at 13 weeks reported inhomogeneous hematoma with an estimated value of 1.3 cc and increased value of left uterine artery value. What does it mean? Is it something serious? What are precautions I have to take? My doctor has prescribed ecosprin for 2 months but want to take a second opinion. Hi Shivani, you are now. So, did you have any bleeding during this time? Probably you had spotting also, so that was a bit of refusing the uterus your pregnancy to continue. You have been given support by a gynecologist hoping for the same. An increased value of left uterine artery value is 2.37 RI. You need to recheck again at 20-24 weeks. You have to continue your ecosprin for 2 months, and at 20 weeks again, if these uterine RI values are higher, you may need to continue this ecosprin for next till 36 weeks. You may need to continue till 36 weeks. Hi भावना, प्रेगनेंसी में ब्लड टेस्ट किस महीने में होते हैं? प्रेगनेंसी में ब्लड टेस्ट आप प्रेग्नेंट होते हैं, आप डॉक्टर के पास जाते हैं तो तुरंत करवा सकते हैं आप। आपके डॉक्टर्स आपका हीमोग्लोबिन मतलब लोगों में शरीर में खून का प्रमाण, आपका ब्लड ग्रुप, आपके थायराइड, आपका शुगर, आपका किडनी का रिपोर्ट, दो चार ब्लड टेस्ट जो वायरल इन्फेक्शन आपको है कि नहीं जानने के लिए है, जैसे HIV, हेपेटाइटिस बी, HCV और सिफिलिस के लिए VDRL, आपकी यूरिन की रिपोर्ट और जरूरत पड़ने पर हीमोग्लोबिन इलेक्ट्रोफोरेसिस करके रिपोर्ट आती है। अगर आपका हीमोग्लोबिन कम आता है तो वो करानी जरूरी होती है, वो करवाएंगे। मैम आई एम 31 वीक्स प्रेग्नेंट। हाय, pursuit of happiness. I don't know your name, sorry, but you are 31 weeks pregnant. You have severe itching, so doc told to get a blood and a urine test. Okay, fine. So probably you don't need not worry. This is a cholestasis of pregnancy in which the liver functions a bit on the lower side. There is nothing to worry. Tablet will be started by a gynecologist, or you need to consult a physician who will guide and give you a tablet which is called urodioxycholic acid. This needs to be consulted with a physician or a gynecologist itself. If she feels, she will write this tablet for you, and she will keep on monitoring your SGOT, SGPT levels. You need not worry. Just I will advise you to get a urine examination, because a few time urine infection is one of the itching during pregnancy. Hi, Antia Kitchen. Does the line on the male belly means a boy? Uh, it does not. A line in the belly is just the melanin pigmentation, which the melanin hormone increases during pregnancy, and it gives out a dark line on the abdomen. The dark line, it depends on the skin texture. So if you get a line on the belly, it does not mean it's a boy. Hi Andrea. Who moves faster, boy or a girl? Both move equally same. Depends on the blood supply your placenta gives to the baby, and it all depends on the growth of the baby. Hi Angie, I feel you're very much worried about you're having a baby girl or a baby boy. Uh, no, a mother can never feel whether it's a baby girl or a baby boy, but I feel that in this era, having a girl or a boy, both are same. Just educate them properly, and both are same. Hello, Sanjeet Kumar. Uh, what are the chances of miscarriage up to which month? See, miscarriage can happen at any time of the pregnancy. If there are genetic anomalies, there are high chances of that patient getting a miscarriage in the first trimester of the pregnancy. If she's having we see cervical length, that is if her mouth of the uterus, which is called the cervix, is weaker, she may have abortion between second and third trimester, that is around 6 to 7 months, between 6 to 8 months, she can get a miscarriage. So exactly depends on what problem is there, and as per the problem, there are chances of miscarriage in the first trimester as well as the second trimester. That is first 3 months or the last second 3 to 4 months. Hi Bhavna. After miscarriage, how much long time we should wait for next conception? And most of them, when we found ourselves that now our body is ready for next conception after miscarriage. Hi, Bhavna. You can wait for at least 3 months for your uterus to settle down and for your body to figure it out again for a next pregnancy. And during these 3 months, it's better you take folic acid, multivitamin supplementation, get your vitamin D3 levels checked. And if it is lower on the lower side, start vitamin D tablets and make it to the optimum mark so your chances of getting another miscarriage is lessened down, and becoming fit for a next pregnancy. Hi Madhvi, I have already answered this question in my live video. I'm repeating it again. You can get your hemoglobin, your blood group, your thyroid levels, a test which is called double marker during first trimester. We can get the whole body checkup in the first trimester also, that is your sugar levels. We can get your viral markers, that is HIV, hepatitis B, HCV, VDRL for syphilis, and a urine examination during first trimester. Hi Rashi, some good in the second month. See, the baby will grow on its on the nutritional status of the mother. So I feel you need to get your test done, and if you are healthy, your baby is definitely going to be healthy. Hi Lakshmi, you have many questions. Hi, Shaila. What happened? The questions has been lost. I don't know how. Hello. I cannot see the questions. Can you just click on that? I told you that the curved one on the dashboard. Click on the curved arrow. You see some questions coming in. Yeah. Thank you. They have come again. Sorry. Yeah. Okay. Thank you. It's done. Yeah. The question. No, I can see. I can see. Then now you can talk. Hi, Lakshmi. Hi, Lakshmi. You have many questions and all related to blood test during pregnancy. Your first question: can I refuse blood test during pregnancy? No, you cannot refuse any blood test during pregnancy. Do you have to have blood tests when pregnant? Yes, you do have to have blood tests when pregnant. How many tests? There are many tests to be done. I'll just list all of them to you once again. You need to get your hemoglobin, your complete blood count, your blood group, your sugar, your kidney report, your thyroid status, viral infections which are harmful during pregnancy, that is HIV, hepatitis B, HCV, uh, syphilis. For syphilis, you need to have VDRL test, you need to have a urine examination done. To check genetic anomalies, you need to have a double marker between 11 to 13 weeks. And if you have missed them, then you need to have a quadruple marker between 16 to 20 weeks of pregnancy. But you need to have every test done. And that you are the test which you are asking at 10 weeks, that is, if it's an NIPT test, if you are a patient having high risk, that your age is about 35, you have earlier baby with any genetic anomaly, then you can go in for an NIPT test. Otherwise, the test which I have listed, you can get those tests done. Good afternoon, Komla Devi Thevar. How accurate is genetic testing for gender at 10 weeks? Why do you need to know gender at 10 weeks? In India, we cannot reveal the sex of the baby in any point of time in the pregnancy from 0 weeks to 40 weeks. So you need to know gender at 10 weeks. Yes, the gender is known only if there are some genetic abnormalities which are dependent on the sex of the baby, then only the sex of the baby is revealed. Sorry, you need not get any genetic testing for gender at 10 weeks. Komla Devi, a baby cannot change its gender inside the womb, and there is no gender blood test to be done. And if it can be done, so we will leave behind this topic of gender testing in the womb. Hi, Kinjal. My MCH blood test, it's basically your hemoglobin levels to be checked, which are everything is fine. It's 12.5. It's perfect. Your BP is a borderline high. You need to take less of the salt. And out of the box for the baby, if you are staying in a red zone in a city or a place where the COVID infection status is high, you need to get it checked. And if you are COVID positive, a few health guidelines need to be followed by you and your doctor, which will be suggested by the doctor once it comes out to be positive. हेलो सर, प्रेग्नेंट हुए कि नहीं है? अगर ये आपको चेक करना है तो बाजार से प्रेगनेंसी चेक करने का कार्ड लेके आइए। कल सुबह की पेशाब उसमें लीजिए और एक ड्रॉप ऑफ यूरिन, उसमें एक वेल होता है यूरिन डालने का, उसमें डालिए और वेट कीजिए फॉर 2 to 3 minutes। उस पर लाइंस आएंगी। अगर सी पर एक ही लाइन आती है, दूसरा कोई लाइन नहीं है, तो आप प्रेग्नेंट नहीं है। सी पर एक लाइन आती है और टी पर एक लाइन आती है, दो लाइंस आती हैं, तो आप प्रेग्नेंट हैं। और फिर आपको आपका गायनेकोलॉजिस्ट और अनीमा, सोनोग्राफ अनीमा, योर वाइफ ब्लड इज नेगेटिव, योर इज बी पॉजिटिव। Would it lead to some incompatibility for the baby? Yes, it may lead to some incompatibility for the baby, but you need not worry for that. As soon as the baby is delivered, we get a blood group check for the baby. We give an anti injection to the mother, and you need to keep a check on the bilirubin of the baby. So, if a negative mother delivers a positive baby, the pediatricians usually call them after 48 hours, after 72 hours, to check whether baby is developing jaundice or not. And if the baby develops jaundice, then it is, if the baby is given phototherapy and the baby is fine. It is a temporary jaundice which will go after phototherapy. हेलो दुर्गा, प्रेगनेंसी में कौन से टेस्ट करवाना जरूरी है? प्रेगनेंसी में बहुत सारे टेस्ट होते हैं। मैं एक बार अपने वीडियो में जब लाइव हुई थी, मैं आपको बता चुकी हूँ। तो एक बार आपके लिए रिपीट करती हूँ। आपका हीमोग्लोबिन, आपका ब्लड ग्रुप, आपका थायराइड लेवल, आपको वायरल इन्फेक्शन नहीं है जैसे कि HIV, HCV, हेपेटाइटिस बी, बीडीआरएल के बीडीआरएल सिफिलिस जानने के लिए आपको यूरिन का एग्जामिनेशन, आपको थायराइड का टेस्ट और एक HB इलेक्ट्रोफोरेसिस करके हीमोग्लोबिन अगर कम है तो अ, इतने टेस्ट आपको कराने रहेंगे। और एक डबल मार्कर टेस्ट 11 से 13 हफ्ते के बीच में, या क्वाड्रुपल मार्कर टेस्ट और 16 से 20 हफ्ते के बीच में कराना रहेगा। हेलो बीके रेड्डी जी, आपका हमने हेलो बीके रेड्डी, आई हैव सीन your case infection. You have not been able to go for an anti scan, but if you had a small retroperitoneal hematoma at 8 week scan, then you need to go for a 12-week scan. You have to check the baby's life, everything is fine. The hematoma has not increased, start resolving or not. So I feel, don't worry about the corona cases around you. You have to follow, cover your face with a mask, wash your hands thoroughly. So if you take care of yourself like this, when you go for an anti scan, wear a proper N95 mask or a simple mask and go for an anti, your hands thoroughly, use sanitizer properly, and you need to get a 12-week scan and an anti scan as soon as possible. Andrea, you can have a boy or a girl on an ultrasound. I've told you that it is a crime in India to ask to know for a boy or a girl. And if you are caught or your doctor is caught telling you, both will be behind the bars. So please stop posing these questions to your children. हेलो माधवी, आपका कोई क्वेश्चन हमको दिख नहीं रहा है, प्लीज अगर आप वापस पूछ सकते हैं. Hello, BK Reddy. If आपके husband, if you and your husband both are B positive, there are no chances that you have any complications in the baby. So don't worry about that. Hello, friends. You can follow me on BabyChakra using my referral code. My referral code is KAVS. Capital K, capital A, capital V, and S, capital S. You can follow me on BabyChakra for KAVS, and I am available for online consultation. Thank you very much.